Hello, everyone. This is Mark Anthony with AI Edge Podcast. I hope everyone is doing great out there. I have a special guest, Dr. Ken Sharlin. He's been on our show before. It's been a few years actually, and today we're going to be talking about reversible neurology. What about Alzheimer's? We're going to go deep into this discussion and talk about some of these blueprints and what is really going on. We hear people talking about Alzheimer's and saying, hey, you can only find out when someone's dead that they even had it, or we can find out a little bit later before it's even too late. You can find Dr. Ken Sharlin at functionalmedicine.doctor. Just want to make sure I got that .doctor. And again, functionalmedicine.doctor and or even .com. And thank you so much, Dr. Ken, for being here. And let's talk about this reversible neurology. What is that? I've never really actually heard that term on the internet. Of course, I'm not a doctor, but you know.
Well, I do have to give a little credit where credit is due. Years ago, I had a chance to meet one of the true geniuses of sales and marketing, Mike Koenigs, and more recently had a chat with Mike. He calls it his $1,000 cup of coffee because it's an hour of his time and it's well worth it. Anyway, we were talking about positioning and the work that I do, and I thought he summed it up fantastically, and that is that, neurological conditions can be reversed. And it's just a new way of thinking about a problem because we've just been programmed that, in fact, that's not the case.
Wow. So for those people out there that have loved ones that they might think they have Alzheimer's, what are some of the maybe say trigger points of knowing that you might have a possibility, maybe a slight case, just a little bit, maybe it's just barely coming on, it's fresh and new.
Right. Well, what I want folks who are listening to know is that Alzheimer's disease, which probably affects somewhere between 7.6 and 7.8 million Americans today, and that doesn't take into account all the people where the changes are happening in the brain. But right now, they're cognitively normal. They don't know anything is going on because this is a disease that can have a 10 to 20 year incubation period. We call it a premorbid state where
Like dormant.
age. It's the changes are happening, but you don't know it because you're functioning normally. Your brain is compensating. You're okay. And then one day you start to notice, I'm having a little trouble with my memory. Then other people start to notice. Then it becomes more of a problem because you're having trouble doing the things you normally are used to doing. We really want to be able to identify the folks who are at risk, maybe before they ever have any symptoms, catch it that early, and make the changes that need to be made to reverse their neurological condition. And it can definitely be done. So,
Well, what are some of the things that people will start to notice that they even have it? Would it be just maybe I forgot, like they'll look at something and it's like they forgot what they saw right away? I mean, or is that just something that could be normal?
it can be things very classically, such as word finding difficulty. Maybe the person's repeating themselves, asking the same questions, forgetting conversations, uh, saying, "Oh, we're riding the car together. Where are we going? We're going to the doctor." 5 minutes later, where are we going?
Oh,
We go to the doctor. That kind of thing. Usually, the clinical definition, meaning what do you see outwardly when you engage someone with Alzheimer's disease, must include what's called amnestic cognitive decline. And we know the word amnesia, basically. So it's usually short-term memory, not so much those hardwired long-term memories, but it's those things that happened 5 minutes ago, an hour ago, yesterday, that sort of thing.
oh, okay. So, what would you say the percentage from 1 out of 10 people that maybe have a slight Alzheimer's before it gets to ripe mode?
Probably the best way to frame it is to look at one gene. Now, by no means is, most of Alzheimer's disease is multifactorial. There are a number of genes that can play a role. There are some far less common cases of what are called familial Alzheimer's, where there is one specific gene that may be triggering it, but these are the exception cases, not the rule. And that gene that I'm referring to that's common in the population is called ApoE4, apolipoprotein epsilon 4. And here's the number. It is present in 30% of the population. And if you're of Caucasian European descent, because it does vary by ethnicity, for example, uh, but if you're average, your average weight guy like me, uh, if I had one copy of ApoE4, my risk of developing late onset Alzheimer's disease would increase about threefold. If I happen to have two copies, because in this case you can get a copy from each parent, my risk would increase 12 to 15 fold. So knowing your ApoE status, there's an ApoE2, which is slightly protective and present about 10% of the population, ApoE3, about 60% of the population, the most common, and then ApoE4, about 30%, not the most common, but common enough to be concerned. Get tested. You don't even need a doctor. You can do, order a kit online, swab the inside of your cheek, for example, send it in and find out your ApoE status, and then take the steps to prevent Alzheimer's disease.
Really? Well, this kit, is that something that you do in your office too? So if people wanted to find that, could they go to your website, or is there anything that you recommend uh, for people, say, in your area? Because I know that you also treat people that are even not even in your area, because a lot of people fly out to you and stuff like that.
Yeah, so I wouldn't be able to supply that kit because I think, among other things, it would sort of imply a physician-patient relationship where I diagnosed you and then there would be other obligations. But certainly, if I had a separate company, like I own a supplement company, I could probably sell those kits just through the supplement company and make it clear that this is not giving medical advice. But one company that is local, and I'm in Southwest Missouri. We have the city of Springfield, which is sort of the hub. I'm in Ozark, which is a little suburb, if you will, of Springfield. But there's a company called Dynamic DNA. And they're just one example. 23andMe, I think that's now defunct, but 23andMe used to run ApoE. So it's probably, I haven't done a search to see how many companies are providing it, but Dynamic DNA is one. You can send in, there's used to be about $100, swab the inside of your cheek and find out.
One of the things that I know a lot of people are wondering is, can you really reverse, Alzheimer's? I mean, how could something like that even be reversed, or is that even possible, or is that just more of just a myth just to get people in the door?
Well, Alzheimer's disease is reversible. I have several cases. We were talking about this earlier, and this is an actual patient I saw today. We can talk about this test. I don't know how clearly it's going to
Oh
show
yeah,
on
we
the
see it.
screen, but it says negative. And this gentleman has worked with me over the past 5 years or so, started in my functional medicine program, came to me, with cognitive issues. We quickly identified the diagnosis. It's really integrated all the important tools in the toolbox. You would never know there was an issue if you met him. He drove himself to the appointment. He lives in a golf community,
Right.
and he just does everything, just goes about his life. And now it was so exciting to have repeated this blood test. So I'd love to talk about more and see that he goes from positive to negative. So by definition, meaning it's not just about having trouble with your memory, but you have to have what we call the pathological changes. You have to have the amyloid, you have to have the tau protein in the brain. Well, he no longer meets that criteria. And that's just one example. I have several in my practice.
Wow, that's amazing. And how long have you been working with people with, say, Alzheimer's and any that type of disease?
Well, I mean, I've been a neurologist for over 30 years. I opened Sharlin Health and Neurology in Ozark 10 years ago, and that's really when we started to implement the principles that we're using even today in our brain tune-up protocol.
That's awesome. It's so what I'm hearing you say, correct me if I'm wrong, because I'm wrong a lot, but when I'm right, I stick with it. Um, would you say that from what I heard you say, is that it's something. So if you have family that have struggled with it, it's normally in the DNA and the bloodline. So it's good to get checked because most likely it's more heritable.
Well, that's a component. So the like I said, the most common genetic marker is that ApoE4. There are a number of other genes, but that is one of the most important ones, if not the most important, at least for what is called late onset Alzheimer's.
Mm-hmm.
Now, we technically define late onset Alzheimer's by age, meaning 65 or older, but I think those sorts of definitions are going to change because really we're in the age of precision medicine and molecular biology. And the more
Right.
we really learn things in a more precise way, if you will, there's less of a need to say, well, there's some magical age cutoff. I have seen Alzheimer's disease in a woman, could have been a man, but it is twice as common in women. Uh,
Mm-hmm.
in her late 40s. That's the earliest I've ever seen. Uh, and seeing someone in their 50s definitely happens, not quite as common. But late onset Alzheimer's disease, I certainly wouldn't today prefer to define it by 65 or older. I'd rather
Oh
have
well.
precise ways of measuring. I should say, I have my own podcast. It's called the Healthy Brain Toolbox. And one of the episodes, I interviewed a physician he's located in Chicago. His name is Ronnie Aburashad. And he developed a test, a home-based anonymous test, meaning, if you're out there in the working world, and you're curious about whether or not you could get Alzheimer's disease, you might not necessarily want to share that with the world. You might not want that even attached to your health insurance policy, things like that. It could change your rates. It could have potentially quite an effect if, um, in certain contexts of your life. And so Dr. Burashad utilizes his test, utilizes the single most important, what we call biological marker, which is called p-tau 217. And
Mm-hmm.
you can engage his company. You go online, there's a whole process. I think there's a screening process to say, yes, we'll allow you to do the test because they don't want it done on, 25-year-olds or whatever. But the point is that they will then send you the kit. You get a result. You have an opportunity to speak with one of their telemedicine experts afterwards, and then they want to make sure that you get in to see a neurologist such as myself to actually confirm everything and to have a therapeutic plan. So even outside of the genetic risk, this blood-based biological marker is the single most important measure that you can look at. And I just want to say one thing that's very important to understand because this is very new data. This is an article that came out in the last week or two that just having even that marker or having ApoE4 does not guarantee you're going to get Alzheimer's disease. And if you have no cognitive impairment, but you're positive, say for p-tau 217, what P is for phosphorylated, depending on your age, these researchers calculated how long it would potentially take before you started showing signs of the disease. So it's pretty.
What were those numbers?
So it was something like if you're 60 years old, this clock, if you will, came in at about 20 years. But of course, the older you got, the time
Right.
got compressed. So even testing for p-tau 217 in someone who's entirely cognitively normal does not necessarily mean this is going to happen tomorrow. And these are just huge windows of opportunity.
Is there a time where if they reach, I'm just using numbers, if they say they're in their mid 70s or 70s, where it's too late to even work on these people?
Now, that is also very interesting because part of my work involves the use of stem cells. I've been involved with stem cell research and stem cell treatments about 5 years or so, and got on board when there was a shift through the FDA to emphasize the use of bone marrow. And I quickly learned how to extract bone marrow, separate out what are called the autologous mesenchymal stem cells. And now there's a bit of a shift toward fat derived stem cells, which we can talk about, what's the difference, what are the similarities. But at any rate, there have been some more recent studies published where people who were far deeper down the rabbit hole, their dementia was much more advanced than most of the cases I'm talking about. And while they didn't completely reverse the disease, the researchers treating these individuals were reporting on pretty dramatic improvements in the testing that's done to look at someone's cognitive functioning, to actually screen these folks and say, hey, you were here then, you're here now. There's been a 10-point increase, quite remarkable. So, I certainly am a believer in early intervention, but your question is there hope for someone with more advanced disease? And there's finally some signal that we may not cure it at that point, but we can make a difference and
Meaning hold it at bay.
hold it at bay, turn it back the equivalent of several years. So they're
Wow.
at a higher level. So I think we'll get there. The challenge is when a disease is advanced, it basically means you've lost a lot of your brain tissue. And, that's probably not going to grow back real quickly. And so memory is really, it's not an ethereal thing. Memory is really about the connections between nerve cells and how they signal one another. And so, if you just have far fewer nerve cells and a lot of what I'll call interference, meaning these plaques and tangles interfering with the signaling itself, then it becomes much more challenging to reverse. But there are some signals that we can make a difference even in that situation.
What's the oldest person that you've worked with that was maybe that had Alzheimer's for say 5, 10 years, or had it for quite a while, and you started working with him and you maybe started to see the reversal and he started noticing a difference? Can you maybe give us a story on something like that and maybe some of the things that you did to help that individual, even though I know that everybody's different?
Yes, and when we were talking earlier about that clock that is sort of looks at this p-tau 217 and anticipates how long it would take for someone to potentially develop symptoms, it's very important to understand that how much that plays into your current question, because this is not something that comes out of nowhere. And this
Hmm.
is really why. And by the way, reversible neurology can apply to multiple sclerosis. It can apply to Parkinson's
Wait,
disease.
wait, multiple sclerosis? Really?
Absolutely. I have, and whether we do it on this podcast or
Wow.
next one where you invite me on, but we can
Yeah, that's
talk about
amazing.
precision medicine and MS.
Wow.
I have patients that are, I would say, and I still see people, I call it conventional neurology. So my clinic is a mix. About 50% of my MS patients are not on what we call disease modifying therapy, and we can track their disease far more accurately than the standard MRI that people who affected by MS would typically have once a year for monitoring purposes. And I don't even, a lot of times I'll skip years on the MRI if I have enough confidence, enough data that the disease is being held at bay through other strategies that we use here at Sharlin Health. But what I'm saying too is, I want to give you a very specific example. I saw a gentleman yesterday in my clinic. Now, this was not functional medicine. He had been seeing me off and on for years, and we're all unique and we're all wonderful. But so I don't want to sound, overly critical of this gentleman, but he was morbidly obese. That means a body mass index greater than 40. He was diabetic. He had high blood pressure. He had sleep apnea. Okay. Everything that you might think of as, well, that sounds like a walking heart attack. Yes, it is. But everything that puts you at risk for a heart attack or a stroke for that matter puts you at risk for Alzheimer's disease. So when we talk about these clocks, it's not just, okay, you're positive for p-tau 217, but you're cognitively normal. You're 60, you've got 20 years. No, no, no. If you're insulin resistant, if you're hypertensive, dyslipidemic, if you have all kinds of toxin exposures, if you have nutrient depletion, you're going to get Alzheimer's disease a lot sooner than that. So again, I had been following this guy. He would show up to the clinic. I'd see him a few times. I'd send him to my dietitian. He'd disappear. He'd come back. So I saw,
Right.
and now he tests positive for Alzheimer's. He looks at me. He goes, "This man had had polio as a child, and there's something called post-polio syndrome that some adults get." And this was a really important narrative of his life. And he said, everything that's happened to me is a result of my polio. And I said, whoa, wait a minute. I said, hold on there. That's not true. That's just not true. I mean, I don't wish polio on anyone. Fortunately, we rarely see
Right.
polio anymore. I'm sorry you had it. But we got to talk about morbid obesity, sleep apnea, diabetes, hypertension, dyslipidemia. We got, not just obese. What does your diet look like? Where are you from a micronutrient perspective? Where are you from a toxin perspective? Those are the things that are going to drive you toward Alzheimer's disease. And if functional medicine is really applied behavioral medicine. It's not about fix me with a supplement. And that's the challenge of functional medicine that we as human beings must be willing to engage. It's a totally different relationship with you, your doctor, your team. My wife, who works in the clinic as a coach, and she's remarkable, she would say, "We work for you. You don't, you're coming to see us, but we work for you. But you have to do the work in the end, right? You have to do the work." And it does work. It does make a difference, a huge difference.
Wow, that's amazing. Um, I didn't realize on how many things can be healed when you're healing, you know, one major symptom, we'll just use Alzheimer's.
Yeah.
Other things will start to be healed in the body also
Yeah.
because it triggers other stuff. Because I know once the Alzheimer goes, other things start to go. We've been told, the second gut is the stomach. So I mean, somehow those are
That's
connected,
the brain. Right. Right. The gut.
especially with things that you're eating.
Yeah.
You can actually, correct me if I'm wrong. I believe that with the things that you're eating, you can also push the Alzheimer to go forward a lot deeper. Was that correct, or
Make it worse or you can make
make
it
it
better.
worse?
And
Yes.
there was that guy, and he's since passed away. I don't remember the name of the movie producer director, but he did that Super Size Me,
Yes. I
nearly
remember.
killed himself in a month just eating McDonald's. So hopefully, very few of us are actually doing that. But but that's just an example of what Michael Pollan calls edible food-like substances, right? But on the other hand, and this is not, woo-woo, out in left field stuff, and this is mainstream medicine, the so-called MIND diet, the modified Mediterranean diet, has
Yes.
not only been found to prevent Alzheimer's and really has positive impact on other neurological conditions, but when people are affected by these conditions, it's been shown to actually improve their cognitive functioning. So you can,
I would agree 100%. I noticed that if I go off the path, that's what I call it, go off the path, and I'm in a rush and I have fast food, my body goes into some type of where it just wants to sleep. It doesn't want to move.
yeah.
And it's funny because our bodies are always talking to us, but we're not listening. You don't need that Twinkie. You don't need that latte. I mean, for me, I drink coffee, right? So I like coffee. Of course, people will say that's bad. Whatever. It's my coffee. I love my coffee, but I do it black. I don't add anything. Because once you start adding the other flavors and stuff like that, you're messing with chemicals. We don't realize that chemicals can advance Alzheimer's in a way that we don't realize, especially with the type of chemicals that are coming on our stuff now that are different 15, 20 years ago.
Oh, yeah. A lot of people are talking about microplastics these days and how they can be found even in the brain. So, you could test for microplastics. There are companies out there providing this sort of testing, and maybe it would be interesting to do it. But in the end, what's the message? Don't be try to minimize your exposure. We live in a world of plastics, and some of that is unavoidable. And I always tell people I'm glad that I can wake up in the morning in a climate controlled home, turn on the light when I want light, turn off the light when I want light, when I want darkness. But on the other hand, we have, by the very nature of the conveniences and protections that we've created for ourselves in this modern society, also created a real divide between us and nature. And,
Hmm.
and I would argue that a lot of the chronic diseases that we worry about today, not so much the old infectious diseases, but those chronic diseases are really a result of not being in harmony or in balance with nature. Things as simple as the sun. I mean, we just went through daylight savings time in 48 out of 50 states, and there's the debate about should you wake up in the morning when it's still dark, and your brain is expecting sunlight, and how that affects people who are not getting that sun on the back of their eyes
It
upon
does.
awakening. I mean, it really does affect us. So there are a
No, well,
lot.
the people are different that don't get a lot of sun. I'm from California, and I moved in 2009 to Vancouver, Washington by Portland, Oregon. Everybody, oh, it's beautiful. It's this. It's great. Oh my God. You know what? I lived there for so many years, and let me tell you something. The people are different.
Mm,
It's not because they're different. It's because of the climate. There's not
mm,
the sun barely comes out. It's raining all the time. Everyone's wearing black. They look depressed. You might as well
mm,
throw some Nirvana on and pull the trigger and give them a cup of coffee. And they're
mm.
not happy. And when you are a happy person and you have enough vitamin D, you see the difference. And when you talk to them, they think something's wrong with you. How do I know? Because when I first moved there, people are like, "Oh, you're from California, aren't you?" I go, "Why you say that?" "Oh, you're just really uppity." But I didn't realize that that was a thing,
Mm.
and so it can affect you mentally.
I remember the first time. I'm originally from New Jersey, did all my training in the Southeast. I've lived in the Midwest a while. I probably went to California for the very first time in my life, maybe 25 years ago. Landed in LA. I think we're going to Marina Del Rey area. And I'm like, this is perfect. Perfect weather.
Yeah.
Perfect. I mean, I could and we all feel it. We all know it. It doesn't take explaining. I had you can see we have a lot of, because of the work I do, see a lot of family members have come in with the patient who's affected, but like I said, the adult son or the daughter or all the siblings and everybody's. Anyway, we're in a room the other day, an exam room, and someone's saying, pulling all these holistic modalities out, saying more or less saying, well, what about this? What about this? What about grounding? I said,
Right.
no. Well, is grounding going to cure your Alzheimer's disease? No, it's not going to cure your Alzheimer's disease. Does that mean it's bad? No, it's not
Will
bad.
it make your body feel a little better? Yes.
Yeah, absolutely. I said, the question is, do you need to go out and invest in all these grounding devices? Or maybe you just take your shoes off and your socks off and go walk around in the dirt or
Simple.
sand and in the sun and take it in. Just connect.
100%. It's the little things. Like, so this weekend I went out to the beach up in Santa Barbara. Beautiful. I'm jealous. Okay. It's perfect. It's just, I can't, nothing else I can say. I go there, I go to the beach with my friends, and the weather's just so perfect. Not too hot, not too, it was just boom. I jumped in the ocean, came out, and I'm like, I just felt like my body needed that. It's like it literally just tightened up, felt great. I'm like, oh my gosh, I jumped back in. The point is that there's certain things that are, if we're listening to our body, when something feels good, that's your body saying you're overdue. Like, I'll bring up something silly. The other day, I started craving cucumbers. I went to the store, grabbed some cucumbers, did some tomatoes, cut them up, made it into like a little salad, Mediterranean salad style, and I put my little dressings on it, and it just felt like my body was saying there's something in there that I needed, and I think that's why we need to have a relationship with our body and pay
Yeah.
attention. Why are you craving avocados? Go look up on Chat GPT. Simple. What is in the avocado that my body needs?
Yeah.
because your body's speaking to you, and it's going to actually tell you what you need. Instead of like you've got 50 different types of vitamins.
Yeah.
Funny
Yeah.
thing is, you know what I mean?
I think
And they're
there's a lot of truth there, although we do have to have that awareness that sometimes those dopamine drives, craving sugar or junk food, and I mean, I personally, at this point, there's very little of that stuff that really attracts me. But I mean, in my whole life, I'm 61 years old. Have I drank Coca-Cola? Of
yeah.
course, but I wouldn't do it today. And I remember giving all that stuff up and saying, this is just not serving me. And thinking, is that going to be really hard? For me, it was not all that hard, but sugar is highly addictive, and it does nothing but destroy us. That kind of sugar. There's data on people that it shortens lifespans. People who drink, sugar sweetened beverages regularly shorten their lifespan by about 5 years on average. And the artificially sweetened beverages are no better at all.
No, I'm a water and lemon guy. So I drink about a gallon a day of just water. I just love water. Matter of fact, I actually force myself in a way. I've trained myself. You're gonna laugh. You'll think this is silly. I don't even know I'm saying it on here, but I'm gonna say it anyways. So when we pee, we're basically draining our system. Okay. And so you're gonna think it's silly. So I know it's bad with plastic bottles, but I do because I play a lot of pickleball, so I like to have just stuff just in case if I need it. So I have like the Crystal Geyser where it's already got the natural minerals in it. So you're gonna laugh. So right when I'm using the restroom, the world's gonna think I'm crazy. It's something that came in my mind, and I do it. Not saying it works, but when I'm using the restroom to go sit down, and I'm as I'm peeing, I'm drinking a bottle of water. So I don't stop until that bottle of water, I know it sounds silly, is done. Because in my brain, I came up with wait a minute, common sense. If I'm peeing something out, I should replenish it right away. I know that sounds weird and silly. I know that sounds, you've probably never heard of that, huh?
I hope you're washing your hands, sir.
Of course, but my point is that I replenished that already came out. A
Sure.
lot of people
Yeah.
don't. They only
Forget to
drink
drink.
water when they're thirsty. That means you're way overdue the limit.
We forget to drink. It is important. And I listened to a talk a couple of years back that actually showed that, there's a neurotransmitter system called glutamate. It's important. It's an excitatory neurotransmitter, but excessive glutamate stimulation can actually be toxic. It's called excitotoxicity. And water actually blunts that glutaminergic
Oh
excitotoxicity,
wow.
where by contrast, being dehydrated activates those pathways. So I thought that was pretty interesting stuff, that to connect water consumption with, one of the main mechanisms of neurodegeneration is excitotoxicity. We see that in things like ALS, for
Hmm.
example. So I couldn't agree more. Foundational health is just that. And that's the beauty of it. We have a system whereby we get very focused on a diagnosis. And the only reason for that, well, there are several. One is because we as human beings strive for understanding. We connect by our very nature to narrative and story. And so we ask those questions: what is wrong? What is happening? We want to give it a name. And the fact of the matter is, for folks with what I'll call mystery illnesses, especially, but it happens across the board. The mystery illness folks are the folks who've been to 100,000 different doctors with a set of symptoms and no one can tell them what's wrong, etc. And until they get a name for it, they will continue to go from doctor to doctor to doctor to doctor to doctor. But once we have a name, okay, and then we can make sense out of the world, now we're ready to engage in the physician-patient relationship, the therapeutic partnership, etc. So that's an important component of it. And then, of course, modern medicine says once you have a name, then it can be treated, because you can't treat somebody without a diagnosis because you have to assign the right drug to the right diagnosis. Functional medicine doesn't really work that way. We have many thought leaders who champion a given disease process, my friend Dr. Terry Walls and her MS, and Terry is one of the most fantastic people I know. But she would, if she were sitting here with us, she would totally agree. She said, don't think that what I'm talking about is exclusively about treating MS. If you do
Right.
this stuff, it's going to help your Alzheimer's, your Parkinson's, your ALS, your MS, your neuropathy, your diabetes. It's disease or diagnosis independent because it's really about bringing harmony or balance back to the systems. And I don't mean the heart, the lung, the digestive tract, the functional biological systems that govern how the body works in the first place. Disease happens as a result of persistent and protracted imbalances. And the body is constantly trying to restore that balance called homeostasis. And when it can't, then we end up with these big name diseases because, among other things, it'll activate pathways. And I always use a sci-fi analogy. I'm an old Star Trek fan. If
Same
the
here.
starship is under attack and they've used up the force fields, the lasers, the phaser, whatever, everything, then if the captain says, "Okay, then we've done every defense thing we can do, used up everything we have. Everybody piles in the little pods. They go out into outer space and they press the button and the ship can explode, detonate because it's better to blow up the ship, your own ship, and get
Right.
away than let the ship get in the hands of the enemy. And the human body has built-in systems, built-in almost like software programs that say, hey, if we can't take care of this inflammation, this oxidative stress, all of
Done.
then we're done. And it activates programmed cell death. That's what it's called, apoptosis, programmed cell death. Boom. And there you go. Then you end up with these big bad diseases. But if you give the body what it needs, you're going to experience the exact opposite.
Wow, this is a really good conversation. Making me think of other things, um, topics that you were talking about. So stem cells. We'll jump on this one here. How can stem cells actually help with really neuropathy? Are you injecting? Is this from the fat? Is this from the umbilical cord? Is this just mesenchymal? What,
Right.
and where are you injecting it? Where? How does that work?
So people, the general public, a lot of people are fascinated, of course, with stem cells. And I like to start out with what are we actually talking about? Because years ago, I was a medical student at Emory University, and the neurology and neurosurgery department at the time, this was in the 80s, so I don't want anybody offended, but tissue research was done at that time, and it was considered ethical. No one was killing babies, by the way. But these were tissue cultures, and they would, for example, plant neurons, cultured nerve cells from embryonic tissue into the brains in people with Alzheimer's disease to see if they could get the brain to start making dopamine again, right? So this concept of healing through cell therapy has been going on a very long time. Under George W. Bush, he put an end to embryonic research. However, in the advancements in stem cell work and in cell biology in general, we now have a technology called induced pluripotent stem cells, which is based on a very simple concept, really, that every tissue in your body, no matter if it's specialized as skin, muscle, bone, retina, liver, kidney, has the exact same genetic information, right? And it's really a matter of what genes are turned on and what genes are turned off. So I could take a skin scraping in theory, and this is one of the hopes of the future. Let's say, Mark Anthony, you need a heart transplant. And there's the issue with donors and matching,
Right.
tissue rejection. No, no, no. I'm just going to get a little scraping from you. I'm going to start growing myocardium in a tissue culture. It's your cells, by the way. And then I'm going to put it through a 3D printer. I'm going to do something. I'm going to
Right.
manipulate the DNA. And actually, it's just going to grow your heart that I can then transplant into your chest. It's your heart, no rejection, no drugs needed, right? We will get there. We will absolutely get there. So, induced pluripotent stem cells are starting to be used. This is not an FDA approved treatment. You're not going to get it from your doctor under your insurance and all that stuff. But I just read a day or two ago that in Japan, the Japanese equivalent of the FDA approved a Parkinson's treatment based on induced pluripotent stem cell technology, whereby these cells are induced into becoming neurons that make dopamine, and they are stereotactically implanting them in the brain.
Wow.
Approved commercially in Japan.
So
Now,
wait, they're putting it right into the brain.
right in the brain. Now, again, that is that kind of thing is largely investigational. I don't even know if you could, go to Japan and make an
No, but
appointment.
it makes sense because when you correct me if I'm wrong, but when you inject a stem cell, it automatically goes to where the inflammation is and it starts to heal that inflammation, correct? And
Right.
then repair.
Well, we're talking, so now you're bringing in more or less a different kind of cell. So we went
Okay.
from talking about we want to replace specific cells to
Okay.
cells that have a whole different role. And this cell type was first really characterized by a gentleman named Arnold Kaplan. I understand he's since deceased, but he's kind of considered the father of what are called mesenchymal stem cells.
Yeah.
At some point in his career, he made an argument that perhaps we shouldn't be calling them stem cells, rather medicinal signaling cells, because that's more accurately a more accurate description of what they actually do. Now, these cells are found in different types of tissue throughout the body. They're found in bone marrow. They're found in really high numbers in body fat, and they can be easily harvested from you. You essentially do a liposuction or mini liposuction, and then either using a mechanical process or an enzymatic process, you can separate out those stem cells and administer them to the person whose cells they are, for the potential that they could have a very positive impact on the disease that you're treating. Again, still investigational, but these are signaling cells, right? So they are sending out growth factors. They are sending out anti-inflammatory signals. They are sending out repair signals. They are sending out signals that say, make new brain cells, and it's actually these signals that are important. So many people in this space are actually administering these drugs just intravenously, even if they're directing it or they're hoping it goes to the brain. There are some potential issues with using these cells just intravenously. There's something called the lung trap, where you're going to just trap some of these cells in the lungs. They don't get to the brain, and the cells don't necessarily cross the blood-brain barrier in all cases, but they're signaling molecules, essentially equivalent to exosomes. They can cross the blood-brain barrier and they will hone in on those areas of inflammation. In my practice, I've given these cells into the spinal fluid. We refer to that as an intrathecal administration. I primarily used bone marrow, largely as a result of federal regulatory language, but the tide is shifting now to open up the opportunities to get back to using fat, possibly better quality and higher numbers. But there are, again, different ways to do this. And it should be part of a whole regenerative medicine plan, right? Because we will go
Right.
back to you're obese, diabetic, have untreated sleep apnea, if you really think stem cells are going to fix all those problems, not only are they not going to fix the problems, but all that money you spent on this stem cell treatment is probably not going to help you, because we're kind of putting clean water into a bucket of muddy water, right? And then everything's still muddy.
Well, that's very interesting. So in my little brain, I'm thinking, okay, well, stem cells like mesenchymal, they'll pretty what really got me thinking about the mesenchymal was when they did research where they got a half a heart, not just the full heart, but a half a heart, and they injected it. And when they injected it, it created another other half of that other heart, which is very interesting. So I and also regrowing backbone if it's not bone on bone. So I mean things like that. I feel like we've hit the just the scratch of the iceberg with stem cells.
Oh, I'm sure there's much, much more to come. But primarily, those types of cells are not creating new, replacing the tissue that you've lost so much as sending signals in
Mhm.
to act as repair signals and growth signals. There is another very important type of stem cell treatment that, while it's not widely performed, it is in our best, medical centers. Northwestern University in the US is known for doing this, and it's helped a lot of people with multiple sclerosis. It's called hematopoietic stem cells. And these are cells that are found in your bloodstream. And the people who benefit from this may have a progressive or treatment resistant multiple sclerosis, which, knock on wood, is less and less common these days because the treatments are so efficacious. However, there is a period of time during which the blood is essentially filtered. These cells are separated out from the rest of the blood. This is sometimes referred to as a leukapheresis. So it's kind of like being on a dialysis machine until you banked enough of these cells. And then the person with the MS, multiple sclerosis, is given a drug that effectively is a toxic drug. It's going to wipe out their bone marrow uh,
Wow.
with the idea that they're what we call autoreactive or overreactive cells that are attacking the myelin, attacking the brain, are killed in the process. And then they're infused with their own cells, these hematopoietic stem cells, that
Hmm.
effectively repopulate the bone marrow and reboot the immune system.
That's amazing.
And the cure rates are astonishing.
With their own cells.
So there's no rejection. But it is an aggressive treatment, to be clear, because there is a period of immune vulnerability after you get the induction drug to essentially wipe out the bone marrow.
Wouldn't it make more sense to use the stem cells of someone younger than yourself, or is that dangerous?
Well, so a couple of vocabulary words, I'm sure you're familiar with them, but just for the audience, we have the term allogeneic, which
Uh-huh.
means cells from someone or something else. I don't promote this or in any way endorse it, but I've seen like shark cells used, and I think it's just a bad idea.
Right.
But that's someone else's cells versus autologous, which are your cells. And just like the kidney transplant or heart transplant situation we were talking about, one of the problems is that you can reject someone
Right.
else's cells. And it's just so easy now to harvest, to culture and grow, expand your own cells and to bank them. We partner with a company called American Cell Technologies, the largest private cell bank in the country. So you come to me once, we'll do a mini liposuction or a bone marrow aspiration. One time, not too bad. Use plenty of local anesthesia, a little light sedation, and you're done. Send the tissue in to American Cell Technology. You effectively have an infinite source of your own cells. The exception here, and you alluded to it earlier, you mentioned it, are things like, placenta or umbilical cord derived cells because they have not evolved, I think, the cell surface markers and things like that that would make your body reject those cells as you would if you got someone else's cells. But there is, these are all, to be clear, not well studied, not FDA approved treatments. That doesn't mean there aren't practitioners out there doing it, but for the viewers and listeners, do know that these treatments, the practitioners who are doing this are operating in a gray area for sure. And just because you can buy something doesn't necessarily mean it's FDA compliant or
Wow.
that it
I love it.
works or that it's safe. So the only area personally right now that I feel comfortable in, that I feel is compliant with the current FDA guidelines, is your tissue and
It
minimum.
makes sense. I mean, it makes sense. I think that when you're cross, I don't want to use the word cross contaminating in a way that's what you're doing. It seems like you're kind of taking a chance, not saying it won't work, but when it's your own stuff, you know,
Right. So this is what we call regenerative medicine. And as my career evolved from conventional neurology into functional medicine, which is more root cause medicine, and then regenerative medicine, which kind of evolved out of the whole anti-aging medicine movement, the reality is that these are different, but they're complementary, right? Regenerative medicine tends to be more targeted treatments, whether it's stem cells, whether it's photobiomodulation, whether it's shockwave therapy or hyperbaric therapy, or you know, a lot of people are interested in peptides, which are essentially drugs, by the way. Let's be clear about that. Whether or not, we know the GLP-1s are peptides, but even things like, C-Lank and C-Max and MOTS and all that stuff, those are drugs. We can use terms that make the accurate identification of what it actually is a little vague by saying peptides, but peptide simply means a string of amino acids, and there is no pharmacological class, because drugs are classed like GLP-1, like phosphodiesterase inhibitors, which is Viagra, right? PD5 inhibitors, HMG-CoA and reductase inhibitors, that's your statin drugs. Drugs are not classed as peptides. Peptides is an invention of an industry that I'm very grateful for, but I don't always completely agree with everything that's been done. And I think people just need to know that some of these things are approved drugs. They're just being used off
right.
label. It's perfectly fine. Some of these have not been studied almost at
Makes sense.
all. And this is why peptides are a moving target when it comes to the FDA. And that's why a lot of people are getting research only peptides. And hey, what you do with it in the privacy of your own home, we don't have any control over. But that's a little dicey as well. So anyway, regenerative medicine is targeted treatment, but we still have to build that foundation. If you're a painter and you have a big canvas, you got your thick brushes for your background, your sky, the mountains, but then you have your thin brushes for all the detail. And by the same token, if we're going to use regenerative strategies, we still have to create that environment for them to be effective. And that's why all of this goes so well together.
Awesome. So if I were to go to your clinic right now and I know that I'm struggling with my memory and Alzheimer's, what does that process look like if I go into your office? What would that do? I sit down and I talk with you for 5, 10 minutes and then how does that work?
A lot more than 5 or 10 minutes. So, assuming you've come with the intention of engaging me in this whole experience, and by the way, I would welcome any of the viewers or listeners, but we do have a process so people can't just show up or make a regular appointment and expect that kind of approach, because we have to block out an enormous amount of time for your care. But it does start with a very good history and physical. I'm going to sit down, I'm going to say, hey, tell me a little bit about what's going on and when did it start? How did it evolve? The same kind of narrative that hopefully you would have with any good doctor visit. A good physical exam. We have to correctly identify the problem itself. So maybe we're doing blood-based biomarkers. Maybe we're doing other testing that helps to really box this in and confirm what's going on. And then we shift gears into the functional medicine. We're going to do a deep dive investigation. I'm going to listen to a story about your life because I want to know about your family history, your birth history. I want to know about the events of your life that may have shaped your health over time and set you up for that tipping point that is the disease we're talking about. And then what are the mediators? What are the things that are keeping you on your current trajectory? Because those are the things we really need to change. I'm going to take a deep dive into labs, not your average lab panel that you would get if you go for your annual physical exam, right? A very deep dive looking at drivers of inflammation, oxidative stress, hormones, toxins, all of those, your genetics, everything that determines your present state of health. And then I liken it to like a 5,000 piece jigsaw puzzle because it can be information overwhelm. Your team, meaning here at Sharlin Health and Neurology, is going to work with you to put those puzzle pieces together. How do you implement the lifestyle changes, the targeted supplementation, the regenerative medicine treatments, everything into your unique, personalized plan? And then finally, it's about tracking, it's about measuring. It's not just about hope, that's important, but it's about knowing, are we getting the data that tells us that things are going in the right direction? Because if the data starts to drift, and that can happen, then we can say, okay, we got to figure out what is it that what are we missing, or what do we do wrong, or where do we get off track, and what do we need to bring back on track? It's one of the most important things that needs to be done in the type of work that I do.
I love it. So what I'm hearing you say, and for the viewers out there, as you guys see, the phone number is on the screen. You can go to functional medicine dot doctor, functional medicine dot doctor. Here's the thing. The new way of doctors nowadays is you go in for 5, 10, 15 minutes the max, and then you're out. And I hate to say this, but a lot of these things, people, my friends out there, they're there to patch it. A lot of the times they're just giving you something that's going to patch it, and it's not really figuring out the root cause. What I've seen just hearing with Dr. Sharlin is says, let's focus, let's look at the root cause. Let's spend about an hour, hour and a half together and figure out where this came from and see where we can get to the root of it to start to heal the top to the bottom.
Exactly. And we're not perfect. And the nice thing is when you can bring in those regenerative medicine strategies, if you're a postmenopausal woman and you're not on hormones, you're not protecting your brain, you're not protecting your heart, you're not protecting your musculoskeletal system, you're not going to suddenly turn your ovaries back on. So there are targeted treatments that absolutely are necessary. And then I am not against medication. I just think that we too often pull the trigger on medication before we consider any other possibility. So if you've done all the things and we're tracking, we're saying, I feel very confident that everything that we need to be doing, we're doing. We can't know everything. We can't control every variable all the time. And sometimes a drug can be very helpful, right? It's really integrative neurology. It's bringing the right tools in at the right time for the right problem, and not saying, I'll never do this, or I'll never do this, or I'll always do this. No, that's not, it's personalized, individualized medicine.
That's the way it's supposed to be, period. And I just want to thank you so much for being here. And those of you that are out there that are starting to struggle with memory, Alzheimer's, and stuff like that, remember, just because someone says you can't heal doesn't mean you have to listen. I believe that God created the body to heal, and He used other people to give people like yourselves that have been told that it cannot be reversed a second chance. So call the number on the screen. You can also, get a hold of doctor. I'm sure they could do appointments over the phone. You guys maybe do Zoom sometimes if somebody wants to get a little more personal. I know that you offer that type of stuff. But again, I want to say thank you so much. And before we leave, I'd like you to maybe give a line or two of someone that's maybe on the fence and that's just kind of giving up hope. Something that you can maybe just tell them before we land this plane and go forth from here.
Yes. Well, I would like to say to that person, if you're feeling hopeless, stop for a minute and think about where that may have come from, because we live in a system that tells us, that essentially dictates to us that there's no hope, that you just have to suck it up, take the drug, plan out the rest of your life. What I'm telling you, and there are other practitioners who follow these principles. I'm one of the very few neurologists who do this work, but there are other folks out there, certainly in the realm of functional and regenerative medicine. And we are here to tell you that that lack of hope is as much a narrative as anything else. And when you realize that you do have the power within you to heal, connect with someone that aligns with your beliefs, that aligns, that listens, right? That connects and that has the skill set and the track record, not just the charisma, and work with them and commit to the changes. Because no one's in the end is going to fix you but you. Yes, we have some extra things that we can bring in, right? No one's going to do stem cells on, therapy on themselves. However, it is a different relationship. Don't wait for somebody to fix you. Find a partner, work together, and you will be successful.
I love it. That's it. And here's the thing, my friends, don't give up, don't lose hope. If you still have a heartbeat, there's still a chance. And all everybody out there in internet land, remember, we do these videos because it's not like, oh, we're just trying to put a bunch of content out there. We do these videos because we know that one video can change one person's life. And if we help one person, we've done our job. So make sure sharing is caring. Share the link, put it on your page, share it on social media. That doesn't cost you nothing. I hope you guys all have a great day. And thank you so much, Dr. Ken. You're a blessing, my friend.
Thank you. Thank you for having me.